So we will work with several commercial partners who have expertise in prostate cancer diagnostics. So these companies will look for new markers, and they will do that by using the samples that we provide them from our patients. So all the data that we will collect for ReIMAGINE will of course be according to the GDPR regulations, and basically all the data that we collect is held by the clinical care team in the hospital, which means that they are the only people who have access to identifiable data. And then as soon as the data goes on a secure server for research, this identifiable data will be removed. So every patient will, instead of having a name, have a study ID, and through that we can then link all the data for research. But it is important to keep in mind that in the rare occasion that we do find something in our research samples that needs further medical attention for the patients, there is a possibility to go back from the study ID that the participant has to the actual identifiable patient information, but this will again only be done by the direct clinical care team. The data for ReIMAGINE will be held on a secure server by Philips, and this is for the whole duration of the ReIMAGINE project, which is 4 years, after which the data will be held again by an academic partner in the UK. So in essence, we're going to use the data from all these patients to come up with a predictive model that can then help us identify who should be treated with what treatment at the time of diagnosis. As all the data is anonymized, there is absolutely no impact on patients' access to insurance, because everything will be stored according to the GDPR, and apart from the direct clinical care team, nobody will have access to this data for our ReIMAGINE project.